the deadly coronavirus continues to disrupt the daily lives of the global population. The World Health Organization now warns that the road to normalcy will be a long one, and there really may never be a, quote, silver bullet when it comes to COVID-19. So far, more than 18 million people around the world have been infected with this deadly virus, and nearly 690,000 have died. Here in the U.S., the CDC projects up to 182,000 American lives will be lost by August 22nd. That is more than 1,300 deaths every day for the next 20 days. So for more on this, we want to bring in Dr. Shoshana Ungerleider. You are an internal medicine physician in San Francisco. So, doctor, we saw a little bit from Dr. Deborah Birx over the weekend. And what she had said was that the coronavirus in this country is entering a new phase. The pandemic is entering a new phase, but it wasn't a positive thing. What does she mean by that?
That's right, Anne Marie. Different than this spring when COVID-19 was disproportionately centered in our few urban hotspots, it's now everywhere, as we've talked about. It's clear, that we're not going to get through this virus. We're not going to get it under control until there's a national plan put forth. I think what we need to do now is change our approach. We all want to reopen the economy and get kids back to school safely, but that's not going to be possible if we don't have basic public health measures in place, with things like test results taking up to 2 weeks to come back. This is essentially pointless. We can't act on these results to reduce transmission of the virus if we don't have the results back right away. Our national infrastructure is nowhere near where it needs to be. And without big changes, things are only going to get worse as many of our children head back to school this fall.
And speaking of testing, Johns Hopkins University is reporting that the testing positivity rate has been rising in most states, at least compared to last week, with 33 states having higher than the recommended rate overall. We often throw numbers at people, a number of people testing positive, number of people hospitalized, but one of the key numbers is the percentage of people who, when tested, test positively, because the idea is when we test a large number of people, the larger the group of people, if we have a smaller percentage of people testing positive, then we may be gaining on this virus. But to hear that the positivity rate is going up, what does that mean to you?
Well, Henry, it's frightening actually to see what's happening across the country, and what you said is right. We are seeing the positivity rate go up. That does in fact mean that the virus is continuing to spread. We very clearly opened up too soon and allowed this to happen. Ideally, we want states at a positivity rate of about 5% or lower for at least 14 days before reopening, and that really hasn't happened. Many states prioritized opening up bars and tattoo parlors over the need to control COVID-19. The non-essential businesses, the crowded indoor places where people congregate, like the bars, the gyms, indoor restaurants, actually need to close. We have to make sure that we protect the key parts of our economy, our schools and our essential businesses before we open up places where people are likely to transmit COVID-19. And honestly, the time to act is right now.
Every day we hear the same thing over and over again. You can debate about drugs, you can debate about treatment. There shouldn't be a debate about wearing masks and social distancing, but still it really seems like there are people who are resistant to this. They still think of this virus as nothing but a bad flu. For most people, I see people with the masks on often, but they're wearing it as like a chin strap. It's underneath their chin or their nose is exposed, and we all know how to wear this thing properly now. And I think that, sometimes, doctor, you watch TV and you see people who are credentialed as doctors or credentialed as scientists, floating all kinds of different theories about whether masks are dangerous for you or which drugs are effective and which ones aren't. And I think it gets really confusing for the public. And I wonder if you worry about whether or not faith can be restored in science. I think the vast majority of people still listen to the science, But there is a group out there that is just not taking this seriously even now.
I'm very concerned, as are my colleagues. Since the beginning of the pandemic, physicians and scientists have been consistently undermined by the federal government. And this starts from the top. Our president has touted unproven, dangerous treatments and prevention strategies for COVID-19 and given extremely unclear and confusing information to the general public about wearing masks, about how to stay safe. I mean, we absolutely need to make every effort to educate the public now and ongoing about how the scientific process works, why we change guidelines based on new information and emerging data. And, gosh, if we have a vaccine, we will need the majority of people being willing to take it, to trust that it's safe and that it works. So I think we have a really hard road ahead, but it's clear that we need someone who supports science to be leading our country.
Listen, before I let you go, and that's a great point, what you just made, I want to ask you about these face shields that are becoming more and more popular. It allows you to actually see somebody's facial expression. So often I'm smiling at people, and I know that they can't tell that I'm smiling at them because I can't see my mouth. And so I think, a lot of people are kind of leaning into these face shields. But I had stumbled upon an article based out of Switzerland where there they had noticed an unusual spike in cases at a hotel. And when they looked at the difference between those who contracted the virus and those who didn't, it was all of the employees and I believe one guest that were wearing face shields as opposed to the face mask, and they contracted the disease. Those face shields, they're open at the bottom. I want to get your take on the shields. Are they giving people maybe a false sense of security?
Well, Anne Marie, what it looks like at this point is that face shields alone are likely not sufficient. We know this virus spreads through little tiny particles, and with having the sides and the bottom of a face shield open, that can be problematic. So they actually need to be worn with a mask as well. The fact that they cover the eyes is thought to be protective, but it's not enough. So I think the takeaway is that you should always, always wear a mask. But if you happen to have a face shield, you need to wear it with your mask.
All right. Good advice. Dr. Ungerleider, thank you so much.
Thank you for having me.